My name is Keith Koga. I'm a registered nurse and I work in primary care. So primary care is kind of a generalist kind of specialty. He or she knows a broad range of different diagnoses and things like that. In high school, I think I was always kind of into nutrition. I think that kind of started the interest. I was hospitalized, I think it was almost 20 years ago, for some depression and things like that. And when I was in the hospital, the way I was treated was just kind of like a really, really good first impression. Just that experience was really kind of a life changer for me. I really was like, wow, this is something that I think I could do well. I graduated high school in 1990, and I think I took a year off. I really didn't have any plans for school. I just didn't really like high school that much. I didn't really attend a lot of classes, almost didn't graduate. I finally did graduate though, and then went to community college and actually kind of enjoyed it. And then attended for a few years and got my associate's degree. And then I took that nursing path, started doing the nursing prerequisites. I went through a RN to BSN program through the University of Washington. With nursing, there's all kinds of different routes you can go. I think at that time, I was a little bit older, a little bit more mature, and I was more motivated to do this because it was kind of something that I really, really wanted. If you don't keep up with technology, you're not going to succeed in the field. The use of email, secure messaging, we do text alerts now for when refills are ready. Appointment confirmations are done through text messaging. Everybody's converting to computer charting. If you're not up to date with it, you're going to be left behind, I think. In my position, I do a lot more patient education, a lot of phone calls, lots of following up on how patients are doing. So it tends to be a little bit more administrative. Let's get your blood pressure, because sometimes if you have a low blood pressure, that can make you dizzy. So let's check that first. I had a lot of mentors. I've kind of used some of the nurses that I worked with as kind of mentors. When I was at the University of Washington Medical Center, I co-chaired a mentor program. You know, everybody kind of relied on each other, and you know who you could go to for help if you needed it. If you'd like to help people, look into nursing as a serious career. Getting the feedback after you help somebody, just the thank yous, and I think that's what makes being in the profession worth it.